Welcome to Lecto. Today we are going to discuss anally applied anatomy. Basically, there are three portions of applied anatomy: developmental anatomy, neuroanatomy, and regional anatomy. But now we are going to discuss regional anatomy, right? The topic we will discuss is the fractures of the clavicle and the humerus. Let's start. Fractures of clavicle. Clavicle also called the collarbone. Here you can see the format and how the clavicle bone is arranged in our body. Here you can see the sternum, which is shown by the black color, and here is the broken clavicle, and here you can see the muscles, which is the sternocleidomastoid muscles. Basically these attach with the both the sternum and the clavicle. And here is the trapezius muscle, which comes actually from the backward position. And here is the deltoid muscle, which is present at the top or at the top corner of the shoulder. And here is the pectoralis major, which actually present in front of the chest. There are two portions of the clavicle: medial portion and lateral portion. Medial portion means medial portion is actually the center of the body, and the lateral portion is away from the center of the body. When the clavicle get fractured, the medial plane move upward and the lateral plane will move downward. Why? Actually, the medial plane move upward because the sternocleidomastoid muscles are involved in the holding or upward movement of the medial plane, medial portion, and the lateral portion will move downward due to the gravity, because trapezius muscles is not able to hold the lateral portion of the clavicle, right? Clavicle is actually the most frequently and the most commonly bone which get fractured, right? Commonly fractured, it means they commonly fracture due to outstretch, falling or hand, because when someone fall on hands, then the most of the chances that the clavicle get fractured. Why? Because there is a lot of distance between the hand and the clavicle. Actually, it fracture indirectly, right? Because of the transmission of the force at the clavicle, right? But what is the common site at which the clavicle get fractured? We will see. This is the clavicle bone, and you can see this is the medial portion. Actually, you can see this is the center of the body, which is shown by the dotted line. This is the medial plane, which is towards the center, and this is the lateral plane, which is away from the center of the body. Actually, we divide the medial segment and the lateral segment into different components. Lateral is 1/3 and medial is 2/3. Actually, you can see the clavicle bone, and we divide it into three parts. One part is for the lateral and two part is for the medial, right? So on the basis of this, we call it lateral is 1/3 and medial is 2/3. And you can see there are two curvature which form upward and which form downward, right? And there is a junction between the lateral and the medial fragment, at which the most probability of the chances that the fracture will occur at this junction here, which is shown by the red color, right? So this is the most common site of the fracture of the clavicle. Next we will discuss Cleidocranial dysostosis. Actually, this is a genetic disease, and they are involved in the malformations of the teeth and bone. And different bones are involved, like spine, legs bone, clavicle, etc. clavicle, it may be completely absent or it may be disformed, right? In that situation, if the clavicle is completely absent, then the shoulder will get dropped, right? And the shoulder will can close just like a book. Here you can see this is a book. Actually, this is the shoulder, right? And if the clavicle is absent, then it may get closed just like a book, right? Actually, the clavicle bone is the bone which hold the chest in wide with spread form, right? And here you can see if the neonatal clavicle during delivery, the most of the chances that the clavicle will get fractured, right? Because during the delivery, actually the bone of the child is actually soft, and there is the most probable chances that the clavicle get fractured. Let's we will see fractures of the humerus. Common sites of the fractures of the humerus are surgical neck, shaft, and the supracondylar region. What actually these terms are? Actually, you can see the structure of the humerus, and this is the head of the humerus, and this is the greater tubercle, and this is the lesser tubercle. Actually, this is the medial plane, and this is the lateral plane, right? Greater tubercle is at the side of the lateral, and lesser tubercle is at the medial side or plane. Tubercle are basically the prominence on the bone, right, at which the connective tissues can attach. These are just like the prominence, right? And below it there is a surgical neck. Right? And this is the shaft of the humerus, and at the distal end, this is the proximal end and this is the distal end, there is capitulum and trochlea. Both of them are called condyle. Condyles are basically involved in the formation of the joint. Capitulum and trochlea are basically the condyle, and the region above them epicondyle. And if the epicondyle is at the median side, then it is called median epicondyle, and if the epicondyle is at the lateral side, then it is called the lateral epicondyle, right? And here you can see the depression, right? Which is called fossa. There are two fossa, coronoid fossa and radial fossa, right? And behind it another fossa which is called the olecranon fossa, behind this bone, right? Here you can see this is the surgical neck, right? Why do we call it surgical neck? Because most of the fracture occur at this point, right? Surgical neck portion, because this is the focus point of the surgeon, right? And here is the shaft which can also fracture, and most of the fracture is the supracondylar region, means above the condylar region. Fracture is basically due to the outstretch, like previous one, out stretch movement, right, falling on hand. And the nerve which is mostly affected is the median nerve, right? And another term which is Volkmann ischemic contraction. right? Actually, an artery which is the brachial artery, right? Passing through the humerus. When the fracture occurs like this one, right? Most of the chances that the fractured bone reduce the size of the brachial artery, and due to the reduction or the, you can say, blockage of the brachial artery, the blood supply forward will reduced, and due to the reductions of the blood supply, the onward forearm and the hand will get ischemic, right? And the hands, forearms and the hand will get reduced in size, right? And the patient will feel paresthesia, numbness at the hand. Actually, nerve also damaged, right? So this is the Volkmann ischemic contraction, right? This is occurred because of the contraction of the brachial artery, which is due to the broken bone. Actually, if we see, this is the lateral epicondyle, median epicondyle, and behind it is the olecranon fossa, just like these two one, coronoid fossa and the radial fossa. When the bone is in the flexed situation, these points arranged in triangle form, right? This is the lateral epicondyle, this is the median epicondyle, and this is the olecranon fossa, right, in flex situation. But if the hand will extend, then these points will arrange in a line, right? This is the lateral epicondyle, olecranon fossa, and median epicondyle, right? Important point. There is a point at the humerus. If this point get fractured, then it will heal or take long time for healing, right? And this portion is actually the, if we divide the humerus into three portions, right? You can see this is the first 1/3 portion, and this is the 2/3 portion, right? The junction between the 1/3 and the 2/3 portion is that point on the humerus. When it fractured, right, the healing process is slow because the blood supply at this point is low, right? Or sometimes it may not unite, right? Two bones not joined together. Dislocation of the humerus. If the humerus dislocate, then most of the chances as there is a glenoid cavity to which the humerus will get infused, right? And when the humerus dislocate at the glenoid cavity, it mostly dislocate inferiorly in downward situation, right? Next we will see what type of fractures occur. Actually, avulsion fracture. We will first see what is avulsion fracture. Avulsion fracture is actually the fracture of the greater tubercle. If the greater tubercle fracture, then it is called avulsion fracture. Avulsion fracture is basically the separation of the part of the bone from the whole body, right? It means you can say the greater tubercle separate from the humerus, right? Transverse fracture, it means if the fracture occur in transverse plane, then it is called transverse fracture, right? Here you can see if this is the transverse plane, and if the shaft of the bone get fractured in transverse plane, then it is called transverse fracture, right? Listen, if these two bones will overlap, if overlap, two bones, fractured bone occur, then the whole length of the humerus may reduce, right? Here you can see the whole length of the bone, and if they get fractured, this is the whole length, and if they override each other, then the size whole length of the bone will get reduced, right? And last word, intercondylar fracture. Intercondylar fracture between the condyle. As we see, condyle, actually capitulum and trochlea are the condyle, right? And if the fracture occur in between them, right, then it is called intercondyle fracture, right? Now we will see which nerve get injured when the bone fractured. If the surgical neck is fractured, then the nerve injured will be axillary nerve, right? And if the radial groove, there is a groove like structure over the humerus, which is called the radial groove, because radial nerve is passed through it, and if the radial groove is fractured, then the nerve injured will be radial nerve. If the distal end of the humerus, here is the distal, this is the proximal and this is the distal end. Proximal means towards the body, center of the body, and away from the center of the body will be the distal part. If the distal end of the humerus get fractured, then the nerve injured will be median. Most of the chances of the injury of the nerve will be median. And if the median epicondyle, this is fractured, then the ulnar nerve will get injured. So this is all about the fractures of the clavicle and the humerus. So if you have any question, you may ask in comment section. Thank you so much.